So welcome everyone, my name is Anna Petherick and I'm a lecturer in public policy at the Blavatnik School of Government. I'm here with my colleague from the third floor, Kate Orkin, who's a development economist, and this conversation is one of a series that we're holding about government responses to COVID-19. So welcome, Kate.
Thanks so much for having me.
So, as an economist, you study cash transfers. In normal times, when we aren't worried about coronavirus, what do we know about the effects of cash transfers on human development and on economic indicators?
So I think overwhelmingly they're an extremely positive intervention. So just before I get into the actual evidence, I think this is a very widely studied question in microeconomics, and we're pretty lucky that over the last 30 years or so, a number of governments have actually chosen to do randomized control trials of their cash transfer programs as they've been rolling them out. So we've got literally hundreds of studies over a whole range of continents about the effects of cash transfers on human development indicators. And this is sort of what's known as gold standard evidence. So it's, from randomized trials, it's really strong compared to a lot of other economic evidence. And so I think there's sort of very immediate human development indicators. So the biggest finding is that a lot of what poor people spend cash transfers on is food. So there was a big 175 study review by the Overseas Development Institute, and that finds overwhelmingly that the grants improve dietary diversity and food security. So often people want to do food parcels instead of cash because they want to make poor people spend the cash on food. That's got a whole range of problems with it because it increases, often reduces prices, and it hurts local producers. And it's often also very difficult to get the right food to the right place at the right time. But it seems that a lot of evidence shows us that cash is very good at getting people the goal which you want, which is sort of better nutrition and improved dietary diversity. The next sort of thing is like the evidence in the longer term. And so here there's a lot of evidence that children with poor nutrition, so in the absence of cash transfers, don't grow properly and they have worse cognitive development. And over their whole lives, they will have worse health, schooling outcomes, and earnings. There was another big World Bank review which found that cash grants actually improve growth, cognitive development, and later outcomes in small children. So I think both in the immediate term on food outcomes and then in the longer term on human development outcomes, cash transfers are really positive. The other thing people often worry about is, well, what happens to the adults in the household? And there's a lot of concern that cash transfers will decrease whether people work. And that is what economic models predict. But that actually that rests on a range of assumptions, including that labor markets are functioning perfectly, which in many countries is not the case. And so there's actually quite a lot of studies that find that it's quite hard to search for work. It's quite expensive. You need money to pay for transport costs and airtime and photocopying CVs and all of those sorts of things. And so in many studies, getting a cash transfer to the household actually increases job search, or at worst, it has no effect on whether people supply labor, but it's certainly not stopping people from working. That's in developing countries, at least. I think in developed countries, the evidence is a little bit more mixed.
In that case, what are the effects of cash transfers in the context of COVID-19 as far as we know so far?
I think just to give a little bit of background, there's been quite a lot of concern about the effects of lockdown in country contexts where people do a lot of their work informally, so they work casually day to day. So in Africa, over 80% of workers are those sorts of informal workers. So either they're agricultural or they're working in urban areas, and they have to go out and get a new casual job every day. And in those contexts, they're not getting a regular salary. And so the effects of the lockdown are extremely severe. So there've been a couple of surveys done in Bangladesh by the NGO BRAC, and they were finding increases in poverty rates of sort of 60%. So seeing a huge decrease in employment rates, a 70% decrease in household income. Food consumption was down by 20 to 30%. So, households are actually seeing an economic shock that is probably worse than the health shock in many of these countries. And so what we know happens in poor contexts when people face a shock like that is they often take very short-term decisions that can end up trapping them in longer-term poverty. So one thing people can do is reduce children's nutritional intake. And that's a problem because, as I said before, we find that children who have malnutrition end up having lower schooling attainment and earnings their whole lives. We also see households having to, during Ebola in West Africa, for example, women had to often entered into transactional sexual relationships to get money or food. And there's actually been studies that, so as I said already, the cash transfers can reduce the effects on children's nutrition. They can also decrease these transactional sexual relationships. So the extent to which women have older partners or end up not having to return to school after the shock. And then the last thing households often do is what's called dissaving. So they sell productive assets like cows or vehicles or phones that they usually use to earn income. And that then means that when the crisis is over, they've lost the means to earn and they can be stuck in additional years of poverty. And it's very difficult for them to save up to get the asset back. And there's been studies in both Bangladesh and Malawi that find that recipients of grants are less likely to do these kind of shock asset sales. And so that means that they don't fall into longer term poverty.
So let's talk a bit about delivery. How do you deliver these cash transfers in the current context?
So there's some really good news, particularly in developing countries. I spoke about this growing evidence base of the sort of strengths of cash transfers. So a lot of developing countries, even very poor ones, have built up quite strong social protection infrastructure over the last couple of decades. So a lot of them actually have systems for delivering payments to very poor families already. So in Latin America and some other sort of lower middle income countries in Africa, and some in Asia, some of these transfers are already given to bank accounts for low income people. So Peru, India, South Africa have actually used their social protection schemes to try and get poor households bank accounts. And then the state uses those to transfer the payments directly. So this is obviously completely ideal for social distancing because people don't have to come and collect a food parcel and queue. They just get the money sent directly to them. So what a lot of countries have done is just to increase the amount of the existing cash transfers that they have already. So South Africa, Kenya, India all topped up their existing pensions or the grants that they had for families with children, and they made those bigger. Part of why they were so comfortable just targeting existing recipients is that we know that these transfers are very widely shared. So for example, young people who are in households with someone who's getting a grant have higher nutrition, they have better schooling outcomes, they have better labor market outcomes. So, the government's already had a network of people that they could distribute money to, and they've just used that, just increased the amount of the cash transfer schemes. The other thing that people have done is actually increase the lists of beneficiaries, but using the same existing payment structures. So that often relies on people having a bank account, but they've allowed people to sort of sign up for new transfer schemes. And then, we've seen many photos of this. Some countries are still using the sort of more old school methods of getting stuff to people, so using food parcels. But that's obviously the least ideal for social distancing because people have to travel and they also have to queue. And we've seen quite a lot of sort of instances of mob violence, which is not only bad from the point of view of violence, but also means that distancing hasn't been occurring. The one thing people have spoken about doing is using mobile money accounts. So particularly in Africa, even if people don't have bank accounts, they often have access to a mobile, sort of very simple way of making transactions on a mobile phone. And there's been quite a lot of talk about using that to send cash transfers, although I don't know of any schemes that are doing that currently.
So if, particularly where places are bringing on additional people they're trying to get these to, are there any implementation issues emerging that we know of?
So, I think that overall they've sort of taken a range of different approaches. So a lot of countries, I think, have been quite smart at doing things that minimize effort. So the one I spoke about was increasing the amounts of existing cash transfer schemes. That seems to have gone really pretty smoothly in a lot of, so the countries that have sent out payments just sort of sent them out straight away, and that worked pretty well. In terms of expanding the beneficiaries, so in a couple of countries, particularly in Latin America, the way that they do the cash transfer scheme is they have a census of the poor that's done quite regularly, and they use that to identify who's going to be targeted for the cash transfer, so who's poor enough. And often countries have expanded that list of beneficiaries. So they already have all of the details. They've just made it easier to qualify for the transfer. And again, that seems to have worked pretty smoothly. So Peru and Brazil have done that. Ethiopia, they kind of adapted an existing program. So they had a list of public works beneficiaries in urban areas. You used to have to work to get your grant, but now they're not requiring people to work. They're just using this as a way to they've already identified people and they're using that as a way to pay them. And then, the last thing that people have done is even when they didn't have people enrolled as beneficiaries for anything, they often had basic bank accounts for the poor. So like India and Chile had those. And then they've paid, sometimes once-off grants into those accounts. So I think the implementation has been pretty smooth. And that was all using existing systems, but just adding in new people or using them in different ways. I think where it's been quite tricky is when they've tried to set up new programs. So, for example, Pakistan has just set up a new grant program. South Africa set up a new grant for the unemployed. And there, it's just really hard to do that very quickly. And so often the call lines have just been, they're completely swamped, or the websites are completely swamped. There have been some countries that have managed that quite well. So like Rwanda, for example, has instituted a new grant. And there the sign up has been quite a lot easier, but it's a very small country. The other thing that Rwanda did that was quite interesting was to use communities in targeting who would be eligible for new grants rather than just letting people sign up. And that seemed to work quite well. But yeah, I think in general, it's been amazing. I think there are last count like 243 new cash transfer sort of extensions or schemes that have been set up. And, the real theme has been that developing countries have been pretty well equipped to deal with this challenge compared to, say, the US, where they've really been struggling to get some of the payments out.
So I just wondered, has corruption been an issue? You've talked about how it's been a bit of a struggle sometimes, and bringing on all these new people, but often that's a concern, right? But does it actually matter in terms of total wastage, the amount of money that's going on these things?
So I think, it would be interesting. I don't know yet of sort of systematic studies that have been done on this. So in normal times, these programs are definitely characterized by, first of all, what are called leakages. So just as the money travels down through the government systems, right to the bureaucrats at the end, just you lose some of it and you're not quite sure what's happened to it. It isn't necessarily officials taking it out for their own personal use. It can be that parts of the system kind of skim off money. And then the other thing that can happen is clientelism, so that the normal targeting criteria aren't stuck to, and instead people give the transfers to, say, political allies, for example. So that happens in normal times anyway. We know from past evidence that happens for other, like, food aid systems, for example. So Stefan Durkon has done some work in Ethiopia, for example, finding that food aid was more targeted at people who had political connections. But I think where they have done estimates in normal times, the targeting of the programs is still pretty good. So in India, NREGA is one of the biggest sort of right to work schemes in the world, and they still reckon 80 to 90% of intended beneficiaries are reached by the program. So I think, these things are probably overblown in normal times. Of course, at the moment, it may potentially be worse because we're trying to set systems up very quickly. I think the kind of overall advice has been that the costs of not getting social protection out are very high in terms of setting back sort of poverty alleviation policies in the long term. So, we should rather try and get the money out and follow best practices where we can, rather than getting kind of really hung up on corruption and leakages. So the things that we know work very well are, try and check people's identification biometrically if you can, or otherwise some way of checking their identification numbers. Being very transparent about who is on the list of beneficiaries. And then, where you can, using more electronic systems and bank accounts, because those are sort of easier to verify. And then, filling in the gaps. In many countries, community monitoring of the way that the transfers work has been very effective. And so those principles are probably likely to apply here as well.
Just a question that occurred to me on community monitoring. Are any of these transfers beginning to be linked to requirements for those who receive them? So, for example, Bolsa Familia in Brazil, you have to, in normal times, get your child vaccinated. And I wondered whether any of these sort of increased cash transfers have been linked to perhaps adhering to certain social distancing policies, wearing a mask, whatever it is that communities can monitor.
So I think actually overwhelmingly people have been rolling back the requirements. So, obviously the one that people often have to do is put your kids in school. And that hasn't been happening in many instances. The other that's been rolled back in some instances, so like in Ethiopia, is the work requirements for public works programs have been rolled back. I think they've also made the programs more generous in that they have kind of raised the level of so usually it was the very poor who qualified, and now like slightly more people often qualify. So I think in general they've been rolling back conditionalities rather than adding them in. I haven't seen anything about sort of requiring people to do particular things. There was one program, I think it was in Peru. It was one of the Latin American countries, but they labeled it the staying at home program. And that was really interesting because it's actually very evidence-based. There was a study in Morocco that found that you could put conditions on transfers, or you can, so actual, like you have to comply with this, it's sort of a legal requirement, there's a sanction, or you can just label them. You can just say, this is the cash transfers for this. So in this case, they did it for schooling. And they basically found that it was as effective just to label the transfer as it was to put a condition on it. And the condition is much more expensive to implement. So what this country was doing with the stay-home grant was actually very clever, was just labeling it and encouraging people towards that behavior. You could do that in principle for a lot of things, but I haven't seen a lot of countries kind of getting to that level of things yet.
So there's been a lot of debate about the child support grant in South Africa, and as I'm sure that people listening can hear, you are South African. So I wondered if you could outline some of the issues going on there and maybe offer some opinions from your professional perspective.
So just to sort of say a bit about what happened there. So the South Africa's had a long history of having social grant systems. So there was always a pension. Even under apartheid, there was a pension that applied to both white and black families. And that has historically been shared very widely in families. So there's been quite a lot of quite famous studies showing that when you go from just not having a pension, you're like age 59, to someone in your household being 60 and being eligible for a pension, outcomes in those households really improve. So the grandparents are really sharing very widely. So the kids have better schooling outcomes. And then also the young people are more likely to have found work. So the pension had been really widely viewed as a success. And then in the early 2000s, they first started giving grants for younger, if you were a parent of a younger child, and then they expanded that right up until you were, if you had a child who was age 18 in the household. So there's a pretty broad system of coverage. I would have to remember it's about, I think it's like roughly a third of the country is living in a household that receives a social grant. So it's a very big system by the standard of other African countries. So there was a lot of debate in South Africa about how they were going to respond to the crisis. The government was quite slow initially. And they had largely been using a food grant system rather than the cash grants. So there's a sort of existing system where if your family is in distress for like 6 months, you're able to apply to get food parcels. And so they were very rapidly trying to scale up that system, but it really wasn't working. So they didn't have an adequate supply chain to get the food out. There was often, the wrong kind of food in the wrong place at the wrong time. There were very long queues for it. They were running out. There were riots. They torched one of the buildings where the parcels were being distributed. And then there was allegations that politicians were stealing the food parcels and distributing them to their families. So all of the stuff that we could have said from research was going to happen if you tried to do food grants happened. But what was interesting was the president very publicly actually said, we recognize that this is not working. And there was a big coalition of civil society groups and academics, including a PhD student at Oxford, who's in the International Development Department, Rocco Zizimia. So they did a piece of work basically showing that the child support grant reached 80%. So in the poorest part of the population, the child support grant was actually the best way to reach people who were in households where people were working informally and they'd probably lost their jobs. So you could use the child grant to reach about 80% of the people who you would normally put on like some sort of unemployment grant. So there was this big civil society coalition, and they mobilized trying to ask for the child grant to be increased. And they showed the sort of precise numbers that you would need to increase it by to get a really good reduction in extreme poverty. The government sort of did a range of different things, and it's quite interesting politically how they responded to this. So I think academically, they probably should have just increased the child support grant. There was a lot of arguments in the cabinet, apparently, because older people in the cabinet said that they thought young people were irresponsible with the child support grant. So there were these allegations that young mothers were getting pregnant just to get the grant, and that they spent it on their hairdos instead of spending it on their children. So they were saying, no, we should top up the pension instead of the child grant, even though the pension doesn't reach nearly as many people. So there was this huge argument in cabinet for about 2 weeks. And then eventually the president managed to negotiate the sort of compromise where they increased both the pension and the child support grant. They increased the child grant probably by less than was the academically like most efficient thing to do, but they did increase both of them. And then they also put in place a new grant, which hasn't worked super well, which is for unemployed people. So it was a really interesting case study of there was a kind of academically optimum solution, and it was very clear to the government what it was. And, the paper we know like went to the Treasury, but there was still a whole lot of political issues, and they weren't quite able to do the sort of evidence-based, most efficient thing, but they did get something pretty good through. And they've managed to expand that grant pretty effectively. Although there was one hiccup in the system, they, like at the last minute, they managed to not increase the payments in one of the provinces and to double the payments in the other province. Was just a computer error. And so now they've like paid these people extra in the province, and it's obviously very difficult to get the money back. And coincidentally, the province that they didn't pay is the only one that's governed by the opposition party. So everybody's saying, no, of course, this is deliberate. I don't actually think it was. I think it was just an admin glitch. But you can see like just the many issues that are at play, and a lot of them are very political in terms of making these decisions that also are influenced by the evidence.
Mm-hmm. So instead of scaling up, let's talk about scaling back a little bit, because if you increase all of these grants, there is a concern, I imagine, about how easy it will be to withdraw them again in the future, and what is even the best advice for how you do that. So what do we know about that so far? As the threat from COVID decreases, obviously the economy won't spring back like that. So what do we do with these cash transfers?
So, I mean, it's a really interesting question. I've been asked this quite a lot in interviews, and people are very worried about it. I mean, I think the first thing I would say is I'm not sure they should be scaled back. I think a lot of these are a really good investment, and maybe it's a good time to make it. So, there's a question about should countries just do this in the long term in general. We've already said there's really good evidence for what they achieve in terms of poverty alleviation. They tend to be targeted pretty well. There's not a lot of leakage and corruption in distributing them compared to many other services. So maybe it's good momentum to get countries to do something that it would be good if they did anyway. I think there's also a question of, when do you scale things back? In many developing countries, the economic crisis that's hitting has a range of sources. So part of it is because of the immediate lockdown, but a huge amount of it is also because there's been massive crashes in commodity prices, in the oil price, in the prices of minerals. Tourism's crashed. So a lot of the sort of sources of income in those countries have disappeared, and that's not going to change anytime soon. So I think linking it too closely to the lockdown is probably a mistake, because the source of the economic crisis is much broader than just the lockdown. And so we need to think about when economic conditions are going to improve. And then I think thirdly, the right at the beginning, I was saying there's actually quite a lot of evidence that transfers are helpful in getting people to look for work. So it costs a lot to look for a job in a developing country. A lot of the time, the cities are really unequal. So the poor people live really far out. It takes a long time to travel to look for work. A lot of the time, it's not done online. So you actually have to go door to door looking for jobs. And we know that in many developing countries, there have been way more layoffs than there have been in developed countries, partly because the contracts are less secure, but also because the government furlough kind of schemes. So the British government is subsidizing many employers. So they're paying 80% of wages for a lot of jobs. That's happening to much less of an extent in developing countries. So a lot more people have lost their jobs. So there's a huge kind of set of workers who need to find work. And probably, at least in some sectors, they're going to be firms that are looking for work. But all of that takes money. So actually having these minimum cash transfers in the economy is probably a good way to help people connect back into the labor force. So I think there's a range of ways in which keeping them going there's a lot of arguments for keeping them going for quite a long time. So that didn't answer your question, but I do think it's important that we shouldn't think about scaling them back too quickly. I think probably labeling them, like just saying this is a sort of intermediate payment that isn't going to go on forever, will probably be pretty well understood. People do seem to, as I said, really connect the label with what the purpose of the transfer is.
Kate, thank you very much indeed.